Hi, my name is Anthea Darling, and I'm a registered nurse at the University of North Carolina, and I'm here today to show you how to do a self-injection of a subcutaneous medication. The first thing you need to have is everything ready to go. Sharps box for disposal of the needles and syringes. You need an alcohol bottle and some cotton swabs, or you can have some fancy alcohol swabs. Your syringe and needle combination, and of course, last but not least, your medication. You do need to make sure that you wash your hands when you're doing this. You want your nice clean hands. If you don't have access to a sink with soap and water, you can use a hand disinfectant to get everything cleaned up. I'm going to use a 3 milliliter syringe with a small gauge needle, depending on which of the needle sizes your doctor has given you. Makes no difference, just ask your doctor which one is easiest. Some of the needle and syringes do not come attached together. You may have to do that. It's easy enough to do. Screw top, just twist it on until it's tight, and there's your needle and your syringe combination. Get your medication. You want to double check to make sure that you have the right medication, the right concentration of the medication, and that you know exactly how much of the medication you are supposed to administer. The first time you open a bottle, it's going to have one of these plastic pop tops on them, if you will. You just pop the top. It's clean underneath. Take your alcohol swab. Wipe off. There's a rubber stopper underneath there that keeps the liquid from coming out. You take your needle, syringe. I'm going to draw back to the 1 milliliter portion of the syringe. This is the amount of the volume that I'm going to be self-administering. The reason you do that is to prevent a vacuum from occurring in the vial. Put the needle through the rubber stopper, turn the vial upside down, and you push that air right up into the vial. And then you slowly draw back to the amount of medication that your doctor has told you to give. In this case, I'm going to be giving myself 1 ml, 1 milliliter of a solution. Now, I don't know if you can see this, but I'm drawing it just slightly past the 1 ml portion. There's a tiny little air bubble at the top. I'm just going to push that air bubble back up into the vial until I get to the 1 ml or 1 milliliter line. The little bubbles are not going to hurt you, but that may change the dose of the medication that you're giving. Once you're to the 1 ml, pull it out, and you're ready to go. So, giving yourself an injection. If someone else is going to do the injection, they can do it in the back part, the fatty part of your arms. Since we're going to do them ourselves today, the areas that you can do them are in the upper outer part of the front of your thigh or around the belly button, within about 2 inches away from your belly button and about 2 inches away from any scar tissue. So, you're ready to inject. Here I'm going to use the fat of my belly. I'm just going to wipe off using the same alcohol swab that I used for the bottle. You take the needle and syringe unit, you hold it like a dart or a pen. Take the needle tip, push it right up against your skin and push. You can use a one-handed technique. And then you push gently until the medicine goes in. And you pull it out. Place gentle pressure for 20 seconds, thereabouts. Don't have to rub it, just gentle pressure. And you're done. Don't forget, when you're done, put your needles and syringes into a Sharps box so you don't throw those in the garbage. You take them to your doctor, return them as directed. Thanks. Hope you learned something.